Monkeypox is caused by the monkeypox virus. It is a disease which is transmitted to humans from animals. Why is it called monkeypox? The name originated in 1958 when during a research its first cases were documented in the monkeys. But it is not the monkeys who are the main carriers of the disease. It is transmitted from infected animals or their secretions. Is it a new disease? Not really. Human monkeypox was first identified in 1970 in the Democratic Republic of Congo. Since then, cases have been reported sporadically from other parts of the world other than Central and West Africa. In 2003, the first monkeypox outbreak outside of Africa was reported in America. In 2018, monkeypox was reported in the travelers from Nigeria to Israel and the United Kingdom, and very recently in Singapore and the USA again. The United Arab Emirates recorded its first confirmed case of monkeypox 3 days ago. So why does a disease which has been present for so long gaining momentum? Studies are underway to understand the disease better, particularly the sources of infection and its transmission, but it may be due to decreasing immunity. It has been seen that people vaccinated against smallpox had a good chance of immunity against monkeypox also. But as you move away from the period of vaccination, chances of getting monkeypox increase as well. Another reason, probably the virus is mutating or changing its phase. That is, it is becoming more adaptable for a human-to-human transmission. How does it spread? Like I said before, it spreads from animals to humans. So close contact with infected animals or their secretions. What about human-to-human transmission? That can result from 1. Close contact with respiratory secretions. That is, prolonged close face-to-face contact. 2. Contact with skin lesions from an infected person. And 3. Contact with contaminated surfaces. What about sexual contact? Well, monkeypox is not really told to be a sexually transmitted disease, but it may affect genitals. And if another person comes in contact with the skin lesions in that area, that could increase the chances of them getting the disease as well. For that matter, anyone who has the rash, either by direct contact with the lesions or even sharing bedding. How does it present? What are the signs and symptoms? Fever, muscle pain, severe headache, skin rash. Now the skin rash may appear 1 to 2 days after the fever, and this may be typically on the face, on the palms, on the hands, feet, less on the trunk. It may also be found in the eyes, the genitals and the mucous membranes. What does the skin rash look like? Typically, there are these little bumps and then vesicles which appear like drops of water which contain the fluid. Then they drain, eventually scab up and peel off. It's kind of what happens in chickenpox. Transmission can also occur via the placenta, that is from the mother to the fetus, or during close contact during and after birth. Who are the people more likely to get monkeypox? Generally, it is a self-limiting disease, meaning you just get better and nothing more is required other than some supportive treatment. But in very few individuals, it may lead to complications and even death. Newborns, children, people who have weak immune systems, whether it is because of diseases such as diabetes, cancer, or because of medicines which cause the suppression of the immune system, all these categories of people, they are prone. What is the incubation period? Meaning, what is the number of days between getting infected with the virus and showing the symptoms? So generally, the incubation period is between 7 to 14 days. It may extend to 21 days in some cases. How do you make the diagnosis? Well, other than clinically, PCR is the test to go for. PCR, it is to look for the virus. Now, the best sample would be to take a sample of the fluid from the skin lesion or a skin scraping. What about prevention? 1. Avoid unprotected contact with the wild animals, especially the sick or the dead, including their blood or even their meat. 2. All the foods containing animal meats or parts, it should be thoroughly cooked before eating. 3. Avoid close contact with infected person. The good news is, and the fourth point, in 2019, a vaccine has been approved for the prevention of monkeypox. Treatment: an antiviral agent as tecovirimat was licensed by the European Medicines Agency, which is EMA, for monkeypox in 2022 based on animal and human studies. It is, however, not yet widely available. I hope this was useful. Please share the video to increase awareness about the disease. Take care of yourself and the community. Stay well, stay safe.